my friends, welcome to one more video. Today we are talking to Wendy Cofran, Senior Director of Global Provider Strategy at Salesforce. She describes herself as bridging the gap between healthcare and technology without losing her sanity and sense of humor for over 2 decades. You're gonna see she's an amazing person. Guys, if you like this video, please hit the like button and don't forget to subscribe and activate the notification bell so you don't miss anything in the future. Let's go. Wendy, thank you very much for joining me today. I know that you are a busy person, and it was a pleasure for having you to have you accept my invitation to be my guest on my channel today. But before I start posing a lot of questions, I would like you to introduce yourself to the audience.
Sure, Rodrigo, and thank you again so much for having me on. I currently serve as our Director of Global Healthcare Strategy at Salesforce, and I focus on helping our customers execute their digital healthcare strategy through digital innovation and transformation. And prior to joining Salesforce, I spent over 20 years as a CIO of a leading post-acute provider, as well as serving on the initial HHS, Health and Human Services, CISA 405D Cybersecurity Task Force. So I'm really excited about our conversation today.
That's perfect. And Wendy, the reason why I was chasing you so much is that I cannot think about any other person with your caliber to talk about trends when you're talking about healthcare and technology. That's why I was so insistent to have you today. So I really appreciate that.
Thank you.
Perfect. But Wendy, I would like to go straight to the point, right? And of course, we're going to be talking a lot about technology and healthcare. But I would like to use one hook that I had from my other guests when I'm talking about other industries. Because one thing that I've been seeing throughout all the other industries, all the other guests that I've been having in my channel, is that the trends is always to be, when I'm talking about, of course, technology-wise, is to be more digital, personalized, and people-focused. What I mean by that is to have the end user in the center of the experience, right? Mm-hmm. Of course, when you're talking about healthcare, to have the patient in the center of the experience. Do you feel, what is your perspective? Does healthcare follow the same approach considering the other industries? I would like to pick up brain on that.
Sure. I think what I see right now with digital health technologies are really accelerating change simultaneously on several fronts in the healthcare ecosystem. I do think that it's shifting the care location to really anytime, anywhere, and sort of out of those traditional four walls that have been the mechanism to serve healthcare. And I also see the care model is shifting to preventative and personalized and more participatory. So I do agree that the health system of the future will absolutely be digital, personalized, and as we talk today, population focus. Right now, we're seeing a huge, profound shift in healthcare towards well-being and wellness and a greater convenience and flexibility and certainly a more personalized experience. And so I think as we start to look at combining the latest in technology and the best of medical expertise, we really will be able to make global healthcare more accessible and affordable.
So when you're talking about to be a global healthcare more affordable and to have the technology to support that, we can bring to this discussion about patient monitoring or telehealth, right? What is your perspective on these technologies to be applied to the population?
It's a great question. Telehealth has it's been around for a couple of decades now, but I think obviously with the pandemic, we saw the need for telehealth really explode. And I think on top of that, we think about how do we virtually manage a population and manage their conditions. And, what's really striking is, according to the CDC, $3.5 trillion in US healthcare spending, and 90% of that is spent on chronic conditions and mental health. So when we start to think about virtual health and telehealth and remote patient monitoring and health sensor technologies, I think they're going to play a central role in expanding our healthcare and then driving this shift to a more proactive care. And it's the need for that sort of real-time insight and feedback if we're going to look at driving better outcomes and ultimately reducing healthcare spending. We've seen continuous glucose monitors. We're starting to see fall detection and prevention devices and heart monitors that are able to monitor in real time. And I think not only are these technologies helping providers provide the care, but I think they're also enabling and encouraging patients and the consumers to participate in their own health and wellness.
You touched so many good points, Wendy, but I would like to challenge in a couple of the points that you bring now to the discussion. Because you mentioned that telehealth has been there for quite some time, for some decades. But do you think that it is ready already to be used effectively? My concern is about the cost associated to that, right? And when this would become a reality for everyone. And I'm not talking about those ones in big cities or close to those providers, but people who live far, far away that probably don't have the infrastructure to be able to use this type of technology. Do you think that it's already there, really, or it's going to take some time to be effectively used?
Well, I think the pandemic and some of the focus that it brought onto it, now it's there's people are reimbursing for it, and again, I think, like I said, the technology's been here for some time, but I think it was a lack of willingness to recognize that it was able to expand access and it was able to be used as a true diagnostic. So I do think it will expand now, and again, reimbursement is very key to any investment that healthcare companies, are going to make. And I think the next big thing is 5G. And when we start to think about what that means for the types of technologies and the sensors, I'm really excited about that, because it's really, I think it's been aptly described as the global nervous system. And I think connecting signals from anywhere and everywhere and then enabling instructing responses, I think that's the impact that's just going to be enormous on healthcare. And we're starting to see the rise, obviously, of cloud computing and connected devices and digital health apps, some of the sensors, things like smart homes, remote diagnostics. So all of these things are going to really be poised to take advantage of 5G's high bandwidth and low latency and reliability, and certainly the security and the capacity that it brings. So when we start to think of, as the 5G infrastructure continues to roll out, I think that's going to provide one of the greatest opportunities for healthcare to drive some health equity and access to care across the population. I think we've seen that with the pandemic, that's a challenge that we need to continue to try and overcome.
Yeah, I couldn't agree more, Wendy. And you just hit the nail, because you bring to this discussion one technology that I had listed to talk to you today is 5G, right? Because exactly what you are saying, probably some concept, some technology, the mindset was already there and has been developed for many, many years. But at least 5G will enable some of this technology to be used in a better way, in a more effective way, right? Without this type of technology before, we couldn't do something, for example, like robotics, right? It was not necessarily we didn't have the infrastructure to use this type of technologies, but now we're gonna have that. So that's why I was more concerned about. We know that it is there, but not necessarily enabled or capable to be used for everyone. So that was my point.
Yeah, no, it's a massive investment in the infrastructure, and I think we're seeing it at the government level. I think we're seeing an investment in the telecom companies. So it will take some time, but it is that investment is just going to have a tremendous impact on the healthcare space.
For sure. But you also bring another good topic to the discussion, Wendy, about data, right? You talk a lot about data when you're talking about telehealth and patient monitoring, right? We know that very concept saying that data is the new oil, right? Where we want to grab more and more data, but not only to analyze that data, but to prescribe, right? Not to be reactive, but to be proactive when you're talking about data, right? What is your perspective when you are talking about analytics and big data related to healthcare?
Well, I think, you've absolutely hit the nail on the head. I think artificial intelligence and machine learning, I think any technology right now that is able to parse the massive amounts of data that already exist, and then we're coupling that with data that's being generated by all of the technologies that we just talked about. So I think that AI is going to allow healthcare entities and companies to really leverage data-driven insights and analytics and to start to risk stratify patients, and then move towards creating that hyper individualized health planning. And that needs to be able to encompass each person's health risk, their lifestyle choices, and even their health goals. So I think for AI, the most impact is going to be in identifying and surfacing that right data, but at the right time, and then putting it in the hands of the right person. And so the other, kind of caveat to this is that AI should not be seen as a replacement to in-person healthcare, but rather a driver to understand the complexities of each patient and reduce costs and unnecessary tests, and then really seek to improve that proactive care engagement and derive those healthy outcomes.
But you said something very interesting, Wendy, among, of course, many other things, but the data to be used by the right people, right? And one thing is that clicked on my mind was security. And when you're talking about health, right, health data, we need to bring security to the discussion. And we know that in the past, the security team was seen more as a no team, right? Which is not the case. I don't believe that. And you have a security background also. But do you think that we have now the understanding that security and healthcare leaders needs to work together to make things happen from a technology perspective? Or do you still think that the security is holding the progress when you're talking about technology on healthcare?
I'm encouraged that technology is now, it's an overused term, but really getting a seat at the table alongside the business leaders. And I think as we start to see technologies, one in particular, blockchain, and in this age of data insecurity and the increases that we're seeing in data breaches and fraud and even administrative errors, it's really not a surprise to me to hear that 40% of healthcare executives are seeing blockchain as a top 5 priority for the industry. We've mentioned earlier about smartphone apps and sensors and wearables, and as these investments continue to pour into the healthcare and wellness industry, the need for a safe and secure way to transfer the data is absolutely critical. So I think the fact that blockchain is designed to deliver that proof of health data and that integrity, and then an opportunity to reduce costs and remove some of the middlemen, so to speak, the middle person, and keep that patient data secure. So we're thinking HIPAA requirements, GDPR requirements. I think all of this is really poises us well to improve, again, the access to health and the health outcomes, and the ability to transport that data and really kind of put the ownership of that data, I think, where it belongs, which is in the patient's hands, and bring that security as the forefront of the infrastructure.
Wow, Wendy, that's why I said you are so great, because you just again brought another technology, which is blockchain, that I would like to discuss with you. And I know by fact that you don't like buzzwords, and we're talking a lot about blockchain because this is a new concept, relatively new concept, but I know there is a lot of misunderstanding when you're talking about blockchain. But I really wanted to pick your brain on how we can use blockchain, or how blockchain will be used on a healthcare environment to be able to help our patients. So for your perspective, it's more to give this confidence that the data is being securely used, right? And we can at least decrease some breaches or bad usage of the data, correct?
Yeah, I think the data and integrity, but it's also the transportation of it. I can't say the word, the transportation of it, but portability, there's the word I'm looking for. So I really do think it's the portability of the data and the trust that this data that's being ported. We have a tremendous challenge in healthcare, and moving data across the healthcare system. So I see blockchain. I mean, other industries are heavily investing in blockchain and seeing success with it. So I do think healthcare is ready to step up and continue diving into that, because it is such a critical need that we have in the healthcare space.
Perfect. But Wendy, I do have one last question, but it's related to something that we already discussed about AI and machine learning. Because we know that there is a lot of concerns when you are talking about AI, right? Because we are giving the power to do some analysis or to provide some diagnosis, right? And not necessarily to remove the human factor at some point during these analysis. Do you have any concerns that we are already ready or we are not ready yet to start leverage this technology to be able to provide diagnosis, to be more proactive, as I mentioned before? Or would you be more cautious on regarding AI into the healthcare space?
Well, I think there is definitely a bias, and I think that we have to continue to work hard to address any biases. But I do think, again, with the massive amounts of data, that we're really not using it as well as we could. So I do see, when you start to couple and layer all these technologies that we spoke about on top of each other, I think we have to be aware of some of the gaps and loopholes in them, but the overall value that they're going to bring to the healthcare system is just so impactful. So I'm optimistic that it will continue to drive better treatments and reduce some of the waste around testing and things that we could eliminate right away. And again, really get that data in the hands of the clinical professionals. Right now, they're responsible for parsing through so much of their own data manually, and it's just, we need to jump up and let some of the technology carry some of that burden, and then let the clinical folks really use their skills and diagnostic abilities to take care of the patients, spend their time there instead of parsing through massive amounts of data.
That's a perfect way to end this conversation, Wendy. And Wendy, as I said at the beginning, I really appreciate, because it's not every time that I have someone with your caliber to talk about technology and healthcare in my channel. I would really appreciate and say thank you for being my guest today, and I hope you had a great time.
I absolutely did. Thank you so much, Rodrigo. I really appreciate the opportunity.